Hi everyone. In this video series, we want to address a topic that affects many people, unfortunately probably also in your environment, eating disorders. By doing so, we want to raise awareness and understanding for the reality of eating disorders, but also explain what you can do if you or a friend or family member is affected. We want to give guidance how to communicate the sensitive topic in social media and explain how you can help to bring a change in mindset. But who are we? We are a team of researchers from the University of Würzburg and Amsterdam, and we want to learn more about the persuasive power of health messages on eating disorders in social media. Thanks to the financial support of the Vogelstiftung Dr. Eckerkamp, we could do some research for this purpose. More precisely, we conducted 2 experiments with young female social media users and investigated how influencers can communicate health messages on eating disorders effectively on platforms such as Instagram. But before we go into the results of our studies, here are a few hard facts about eating disorders. So, what are eating disorders? There are several different types of eating disorders recognized by mental health professionals, and we will now take a closer look at 3 of the most common ones. Anorexia nervosa, we start with that one. People with anorexia nervosa have an intense fear of gaining weight and distorted body image. They restrict their eating behavior significantly, which can lead to severe weight loss and often becoming dangerously underweight. Individuals with anorexia may engage in excessive exercise, but also have a preoccupation with food and calories and exhibit restrictive eating patterns. And anorexia nervosa often has its onset during adolescence or early adulthood. Then there's bulimia nervosa. Bulimia nervosa is characterized as a cycle of binge eating, followed by compensatory behaviors to prevent weight gain. Binge eating involves consuming a large amount of food in a short period and often feeling a loss of control. Compensatory behaviors then can be and include self-induced vomiting, excessive exercise, fasting, or the misuse of medication. Last but not least, the third eating disorder that we want to talk about is the binge eating disorder. Binge eating disorder involves recurrent episodes of binge eating, similar to bulimia nervosa, but without the compensatory behaviors. Individuals with binge eating disorders often feel a lack of control during these episodes, and they may eat quickly past the point of feeling comfortably full. And it's also very common, unfortunately, that they then experience distress, guilt, or shame following the binge episodes. These are just 3 of the most common eating disorders, but there are way more symptoms that, for example, do not meet the full diagnostic criteria of anorexia. And examples include atypical anorexia, which would be significantly restrictive eating, but without the low body weight. And also several eating disorders that are less common but still recognized. Now, who's affected? In 2019, right before the COVID-19 pandemic, about 40 million people experienced eating disorders, including almost 3 million children and adolescents. And this number has even increased due to various stress factors of recent years. In Germany, for example, about 20% of children and adolescents aged 11 to 17 suffer from eating disorders, with girls almost twice as often as boys. Now, why adolescents and why young adults? So, adolescence and also young adulthood is a period of emotional vulnerability, as young adults navigate their way through increased academic pressure, through identity formation, and also relationship challenges, both in friendships, with family, but also in romantic ones. And in line with this, eating disorders can serve as a way to cope with negative emotions, with stress, or even traumatic experiences. Also, the physical changes that occur during puberty, such as hormonal fluctuations and changes in body composition, can create additional stress and anxiety about body image. As a consequence, adolescents may feel a lack of control over their changing bodies and turn to disorder eating as a coping mechanism. Besides, there's also a lot of social comparison, and it's important to know about the role of that because social comparison and the desire to fit in can contribute to the development of unhealthy eating habits and behaviors. Young individuals are exposed to a persuasive media culture that often promotes unrealistic beauty idols, and a narrow definition of attractiveness, especially in advertising, but also on social media. And this can contribute to body dissatisfaction and a desire to achieve a perceived ideal body shape or size. Especially because teenagers and young adults hang out a lot on social media and are more likely to be influenced by the content presented, it can make sense to communicate preventive messages on precisely these channels. We will show you how to do that in the next videos, but first, let's look at the content that you can cover in health messages on eating disorders and social media, like the overall topics. So, what issues can you address? There are lots of issues that can be addressed actually in the context of eating disorders. And what is important to keep in mind is that you tailor the communication to the specific target group and also maybe to the specific affected people regarding a specific eating disorder. We personally, as a research team, decided to address young women aged 18 to 30 years. And based on the insights that we gained from our research, we can recommend communicating the following topics. So you can, for example, start with presenting facts and figures to provide a rational perspective on eating disorders. This can be especially helpful since the topic is very emotionally loaded often, and giving also a rational perspective can help. Moreover, you can also introduce help centers and organizations that offer support for those affected. Furthermore, what can also help is highlighting the negative influence of social environment. Unfortunately, comments, for example, about weight and appearance from friends and family members that were not even meant to harm, they can be really harmful and they can be avoided and should be avoided. And this can also be addressed. You can also discuss nutrition-related issues, including the dangers of dieting, skipping meals, and the negative effects of binge eating, for example. And you can also provide tips on healthy eating, including fresh fruits and seasonable vegetables, but also make sure not to be restrictive in your recommendations. Moreover, you can also help to critically examine the media's unrealistic ideal body image and also address, for example, the issues of edited images and the impact of body comparison on social media. In doing so, you can then also suggest reducing one's screen time, for example, if necessary, or promote accounts that emphasize a positive body image. Moreover, you can also encourage people to pay attention to their body signals like hunger and fullness, trust themselves, and also promote flexibility in food choices. What you can also do is provide guidance for friends and family members, including how they recognize signs of eating disorders, asking them to being patient, recommend them offering support, and avoiding those comments and remarks about weight and figure that we already talked about. And you can also encourage them to share their observations and concerns without accusations and just have an open conversation about what to do with the ones affected. Last but not least, one recommendation, you can also explain that it's totally normal that body and shape can change from time to time. And this time to time can be really a wide range. So time to time can mean that in puberty this changes, in pregnancy, after pregnancy, etc. But also within a few weeks or even during the course of day, it's totally normal that your body looks different in the morning than it does in the afternoon or in the evening, for example. So these are just a few suggested topics that can be addressed in social media and that can be really helpful. Of course, there are many more with weight-related bullying, and which should be avoided, obviously, just being one example. So that is it for our first video. Make sure to check out our other 2 videos in which we talk about more about the construction of health messages on eating disorders and the persuasive mechanisms behind them. Thanks for your attention.